Hello, everyone, and thank you for tuning in. In this episode, Dr. Lauren Schachner will share some highlights and clinical pearls regarding new acne treatments for pediatric patients. Thank you for being with us, Dr. Schachner.
My pleasure.
Dr. Schachner, what do dermatologists need to keep in mind when prescribing treatments for pediatric patients with acne?
Well, it's not always a fair ball game when you're treating young kids, pre-adolescents and adolescents for acne. It's one strike and you're out. So if the kids really have an adverse reaction or negative feelings about what you're prescribing, you're out. They're not going to use them, probably not going to come back, and it's a waste of time and energy for everybody. So remember, you're dealing with kids, and they don't have a high level of adjustment when things are a little adverse. So when you're using things like benzoyl peroxide or even topical tretinoin, remember, they're more or less universally irritating. Don't go full dose, don't go full application when you start the treatment. Nothing wrong with telling a kid, this may be a little irritating, why don't you put it on 15 minutes the first 3 days? Always wash it off with lots of cold water. No irritation, go to 30 minutes for 3 days, then go to an hour. If you can then apply it for an hour, that's the end of the week, and not get irritated, you'll be fine. And they will be, and they'll keep using it. Otherwise, they're going to be red and scaly day one, and they're going to hate you and throw out the medication.
How do these new acne treatments address the issue of antibiotic resistance?
Well, that's a great question. You know, dermatologists and pediatricians are among the two highest level of antibiotic prescribers. So we have a lot of responsibility for stewardship and smart usage of antibiotics. And I'm afraid we haven't always come up to the mark we would like to. And now we're seeing a lot of resistance emerge to some mainstream antibiotics. So where you can, let's be targeted. The new oral antibiotic sarecycline, for example, is really targeted at the cutaneous flora. It doesn't knock out the gram negatives in the gut like the first couple of generations of tetracyclines have done. So that's a great example of one way, and it's once a day use, so the kids like it. So that's a great example of one of the things we can do. Instead of all the oral medicine we have been prescribing through the decades, there's now a topical medicine. There certainly are advantages to being able to put something on the skin as opposed to into the whole body. But I will caution my colleagues that the Global Alliance on Acne also recommends with any use of topical antibiotic, you add topical benzoyl peroxide because that helps to decrease the emergence of resistance, even for these new agents.
Can you tell us a bit more about the effects on these new acne treatments on the microbiome?
Well, we have through the years seen tremendous emergence of resistance to topical antibiotics. A case in point might be erythromycin, which was a valuable agent 30, 40 years ago, a go-to drug, and now really an enormous amount of resistance, not only from P. acnes, but also from staph on the skin. So we need to consider how we're using them and what damage we can be done. The concept that I gave of always adding benzoyl peroxide when you're using another topical antibiotic certainly is one way we can save the microbiome. We do not want to alter the microbiome and get overgrowth of undesirable organisms, which can exacerbate acne or cause other problems. But we do want to get the job done. So we have to have a balanced approach. I think the one I suggested would help.
Thank you so much, Dr. Schachner, for sharing your insights with us today.
It's been my pleasure.
And thank you to all of our listeners for tuning in. Until next time.